We have a lecture today about mental health. About 1 in 4 people have mental illness, so you can be the one who help. Regarding the burden of mental disorders are 13% of total disease burden globally. In addition, depressive disorders are the third leading cause of disease burden. Regarding mental disorders burden, they are 13% of the total global burden of disease. In addition, depressive disorders are the third leading cause of disease burden. The major problem is that about 85% of people with severe mental disorders receive no treatment. As a result, people with mental disorders have high mortality rates. So, what is the definition of mental health? Mental health can be defined as a state of emotional well-being in which person is able to function in comfort with the society, and also person can have satisfactory achievement. Mental health doesn't mean only absence of disease, but it also means the ability to live in comfort with others, to understand and accept own feeling, to be mature, have mature responses to different situations, to have a creativity, to deal with anxiety and stress, and have satisfaction and constructive achievement, in addition to can use leisure time in profit way. Now we have an important question. What are the factors that distinguish mental health from other public health problems? The first difference is that mental disorders aren't usually listed as a direct cause of death in death certificate. Second cause is that mental disorders can be detected on autopsy, so they are difficult to be detected and reported. Third cause is that mortality statistics represent little burden of the disorder proportion. In addition to the previous reasons, the fourth reason is that hospitalization rate are one of the statistics that can be used to measure the burden of mental health disorders. Personal interviews must be used to obtain access to mental life. And finally, diagnosis of mental disorders depend mainly on result of comprehensive mental examination. So diagnosis is not easy. How to promote mental health? This is an important question. We are going to answer it now. Security from early childhood to old age is necessary. At contrast, insecurity leads to anxiety and insufficiency. Independence and freedom are also necessary for mental health. One of the most important factors for mental health is the achievement and success. Another important promoting factor for mental health is companionship. Companionship means acceptance by others. Self-acceptance and self-respect are crucial to mental health. Person without self-acceptance and self-respect feel disturbed. Now we have an important question. What are the causes of mental disorders? Causes of mental disorders can be classified into two major categories. First is environmental causes and second is individual causes. Regarding the environmental causes, they are further subdivided into social factors and physical factors. Social factors means the social environment in which we live. Stress rates represent an important cause for psychiatric disorders and psychiatric troubles. In addition, chronic stress and strain at work or home is a major factor, an important factor. It's more important than stressful life events that have a transient and minor role. The environmental factors were subdivided into social environment and physical environment. We have already discussed the social environment. Now we will discuss the physical environment. We have two major factors in the physical environment. First is the occupational exposure. For example, the exposure to heavy metals such as lead and mercury, they have CNS disturbance. In addition, homelessness is an important cause for mental disorders. Now with the individual factors. Individual factors are as the following: gender, age, social class, ethnicity, marital status, and finally physical health status. When it comes to gender, some disorders are common among males and others are common among females. For example, the use of alcohol is more common in males. However, depression and phobias are more common in females. The frequency of mental disorders differ according to the age. For example, anxiety disorders are common among those aged 18 to 35. However, dementia is common after 60 years old. Regarding the social class, lower social class people are more liable to depressive symptoms, alcohol abuse and dependence, and antisocial personality disorders. Being single is associated with higher psychiatric disorders. It can be cause or result. In addition, recently separated or divorced individuals have higher rates of depression. Physical health status is also an important individual factor for mental disorders. There is an important link between physical disorders and infectious disease and also chronic disease. Familial factors are also an important individual factors for mental disorders. For example, monozygote twins have higher considerable rate of schizophrenia. Although the exact etiology is still unknown for the season of birth and mental disorders, but it can be observed that certain season of birth are associated with certain disorders. We can discuss mental health without discussing the prevention. Prevention is the fundamental function of public health. When speaking about prevention, we start with primary prevention. In primary prevention, we are searching for the causes and the etiology, and we address them and eliminate them to prevent the occurrence of the disease. In addition, we promote the mental health status through physical exercise, removing stress from the environment, consolidation of family life, control of economic factors. As it's well known about the second prevention is that it's concerned with early detection and treatment. The provision of mental health services and treatment is necessary for secondary prevention. So, the availability of mental health services, including early diagnosis and management, is necessary. The integration of mental health services into primary health care setting is also an important factor, besides the collaboration with non-medical community agencies. Tertiary prevention usually includes rehabilitation and minimizing the disability. So, for mental disorders in tertiary prevention, we provide rehabilitation service that minimize handicapping situation and minimize the disability. An important component of the tertiary prevention in mental health is prevention of recurrence. Prevention of recurrence is a major problem in mental health disorder management. The compliance with medication is an important factor to prevent the recurrence. In addition, meticulous supervision and follow-up for those who are recovered is an important issue in the tertiary prevention. In addition, providing support and education from families can help to minimize the recurrence. Avoiding long-term placement in mental hospitals is an important factor for better recovery and rehabilitation. Hospitalization should be indicated only when it is necessary and for short duration, and then early discharge and integration into community is important. Rehabilitation services are crucial to restore function to maximum level and also to integrate the individual into the society. These are some advice for you to keep your mental health. First, try to be positive and have always positive attitude and believe in yourself. Second, it's an important factor to have realistic expectation to stay in a mental health status. When having realistic expectation, you avoid disappointment. Here is a particular advice for medical students. To have enough rest and enough sleep is necessary for good function and good achievement and for good health status. An important advice is to talk about your feelings to others. Expressing your feelings to others help you to relieve stress and cope better with stress. We have now a well-established evidence from research that exercise in a regular way help to promote mental health. Well-balanced diet is also proven to be crucial for mental health status. One should learn to relax. When you feel yourself stressed and burned out, you should stop and have a break to be able to continue. In addition, avoid caffeine and alcohol intake. You should search for the activity you find it meaningful and full of pleasure and participate it. In addition, you should learn the ways of stress management and different stress controlling techniques. Now we are summarizing the 10 ways to look after your mental health. First, talk about your feelings. Second, eat well. Third, keep in touch with surrounding with family and friends. Third, take a break when you are stressed. Accept yourself, accept who you are. Stay active with regular physical activity. Avoid drinking caffeine and alcohol. Usually, don't feel ashamed to ask for help from your beloved friends and beloved family. Do the activities you prefer, and finally, care for others. I hope that you find that lecture easy and useful for your study and for your life, and I will appreciate your question. Keep in touch and thank you.